Welcome, guys. How are you? You guys are here for the accelerated second degree info session. So my name is Vicki Jaskowitz. I am the advisor in the School of Nursing. My students are all admitted nursing students and they're been admitted to both the accelerated second degree program and the traditional program. So I have many students, very busy all the time. My other part of my job is nursing applications. You have to apply to be admitted to this program. I coordinate the entire nursing application process. I score nursing applications. I'm on that committee who selects students to enter. So you've taken the time out of your busy schedules. I know it's a 4 o'clock in the middle of the week, so I'm sure some of you had to leave work early and do all that kind of stuff. So I'm going to give you a lot of information because you came today, okay? We don't typically record. Normally, most of the meetings are broadcast live. And if you were looking for that today, there were some unforeseen circumstances where we couldn't broadcast it live. So I'm being recorded today, lucky me. And that's why I have a mic on. It's just so that all the recording. So that for those people who couldn't attend today, we are going to post this in a few days on the web, okay? So, but I'm here to answer any questions you might have. I don't have a PowerPoint. It's a very casual meeting. You can ask as many questions as you want. There's no dumb questions. Somebody's thinking the same thing that you are. I'm all about informed decisions. You want to get all the information to make sure that nursing is what you want to do and that U of M-Flint is a good fit for you. I'm not here to push U of M-Flint on you or nursing on you, okay? You have to make that informed decision. So what I like to do to start out is I like to kind of know my audience, if you have a degree already, what it's in, if you're working in that field, and where it's from. So I kind of ask those questions. So we're going to start with you. You're the lucky one, the first one. So your name, what your first degree is in, where is it from?
I'm Hannah Weiss, and I went to Michigan State, and my first year is in anthropology.
Okay.
And I'm getting ready to start taking prerequisites.
Okay. I have tons of Michigan State students who apply to our accelerated program. Tons. Now, the thing that you have to worry about is because the anatomy and physiology courses at MSU, if that's where you took them, they don't transfer because they don't have labs with them. Okay, so I don't know if you took anatomy and physiology there yet, okay, at Michigan State. Did you take them in your first degree? Did you? Were they ANTR 350 and PSL 210 or PSL 310? Okay, did you, and ANTR 350 also?
I didn't take that. I was going to take that now.
Okay, so the biology department has reviewed those and they won't let them count or fulfill Bio 167, 168 required for nursing. But nursing will allow those to count for 167, and then you have to take 168 somewhere else, okay? But we allow that. We're giving you a little bit of a break there, okay? But you have to have, and again, the reason is you didn't have labs with those courses at MSU. MSU does offer 1-credit labs that you can go back and take if you choose to do that, but lots of MSU students. So I'm gonna go up and then back down, so go ahead.
My name is Jennifer Gottlieb, and I graduated last year from Grand Valley with a bachelor's in exercise science.
Okay, very good. And are you working in that field?
I am. I work at Beaumont right now.
Oh, you do?
Rehab, so
okay.
Stress testing.
Yeah, a lot of stress testing, but a lot of students tell me all the time that the upward mobility of that and the opportunities are very limited.
Yes,
so that's why they want to do nursing.
Yes.
Yes, very much so. Go ahead.
I'm Jeremy Frederich. I graduated from UM-Flint 2014 with a BS.
In what? What was your?
Medical science.
Okay.
And currently right now I am a massage therapist.
I like massages. Yeah, okay, very good. Go ahead.
My name is Lauren Lofthouse. I graduated here at UM-Flint a couple years ago from healthcare administration. I was employed for a little bit at Diplomat Specialty Pharmacies, but currently I am a server at the laundry.
Okay. We have a lot of healthcare administration students also apply to nursing. Lots. Yeah, go ahead.
I'm Megan Grobel. I graduated from LBN with my bachelor's in biology with a concentration in pre-med.
And we've met before, haven't we?
Yes,
That's
I was
what
at orientation.
Yes. Oh yeah, okay.
Yep. And currently I am a safety sitter for the mental health at Nuclear in Port Huron.
Okay, that's a big job. Takes a special person to do that.
Oh yes, it does. I feel like everyone should in the hospital be a safety sitter at one point.
That will definitely benefit you in nursing.
Madeline Terrell, graduating from Eastern business degree. business administration rather. And currently I work in administration in the cardiovascular center.
Okay, very good. Go ahead.
My name is Marie Ernest, and I got my Bachelor's Arts in Fashion Design from International Academy of Design and Technology.
That's a totally opposite from nursing. Yes.
It is, but also right now I'm currently working at MTA, and the division I'm in, we service the elderly and the disabled. And as far as nursing goes, I've had some family members, kind of get sick and this and that, and I'm kind of like really diving into better health choices and everything. So and all the clients are always telling me, "Man, you make a great nurse." And I've been hearing that for years.
Years you've been hearing it, so you're like, I'm doing it. Yeah, I'm doing it. Yeah.
So I feel myself going in that direction anyway. So
Yeah. To be a nurse, you have to be very caring, empathetic. You have to have very good listening skills. You have to be a team player. You work with all the other medical professionals taking care of that patient. So it takes a very, very special person to be a nurse. And I tell students all the time, you have to have that in your heart. It's like a calling. It's a very, very special person. It's like being a pastor or a teacher. It takes very special people to do that. And you want a person who has that calling for nursing, that wants to be a nurse at your bedside and taking care of you or your loved ones. You don't want somebody taking care of it who's just going into it for a job, not at all. But with nursing, a lot of people do go into it for jobs because it's a guaranteed job when you graduate. There's a nursing shortage. All of my students have jobs when they graduate. They can go anywhere in the world. They have a guaranteed job for life. If they're working in Genesee County, it's one of the higher paid counties, they're starting out about $60,000 a year. So that's decent money for a new grad. Decent money. Way more than I make and way more than Chelsea makes, right? And we've been in higher ed for a long time. But again, you have to have that heart for nursing, definitely. Nursing is hard work. You're working 12-hour shifts, you barely have time to go to the bathroom or eat your lunch or whatever that might be. You might have great patients, you might have crazy patients. You might have great families, you might have crazy families. I remember when my grandma, she passed away a while ago, she was the sweetest, kindest lady. And then when she got older, she wasn't so nice, and we put her in a nursing home, and she'd swear at people and try and bite them and spit at them. You're going to be dealing with all of that as a nurse. You know what I'm saying? That's hard work. So, yeah, I'm sure you do. I'm sure you do. So, anyway, so again, this is an open meeting to ask many questions as you want. Any burning questions at the moment? I have lots to tell you. Go ahead.
So, I was looking at the application, starting it. I was confused on the references. I know there's reference forms. Are those the only things that are required?
Those are the only things that are required, yes.
No letters?
No, you can. If they want to submit a letter on top of that, they can. But that's why we have those boxes where they can write additional information. That is the only thing that's required.
Because when I was applying for PT school here, there was more in-depth reference letters that you actually needed.
Yeah, nope, you don't need. That is the form that your references would fill out for you. Okay. Go ahead.
What would you recommend as a reference?
Well, for references, we recommend that you use science faculty. In your prerequisites, if you're looking at this packet that I gave you, and the prereqs are at the top, how many of them are science courses? An A&P1, A&P2, microbiology, chemistry, pathophysiology, pharmacology. 6 of those courses are science courses. So I always tell students that come to these, I'm going to give you big tips. That is a big tip, definitely science. That's something that we look at. When we review your nursing application, it's very holistic. We look at everything that you're submitting. So when you're submitting your references, we're looking at where they're from. Are they from UM-Flint faculty or other faculty? Are they from science faculty or different faculty from a different department? We're looking at all of that. We're looking at your science GPA, your prereq GPA, your last 30 credit GPA. We're reading your essay and what you say. Did you follow directions? We're looking at your transcripts. How many repeats have you had? Where did you take pathophysiology? What grade did you get in that? We're looking at everything. So everything matters in your application. There are some nursing programs that just look at GPA only, just science GPA. Some have ATI or a TEAS test that tests you on your knowledge of your prerequisite courses, okay? We don't have that here, but everything matters in your application. And the biggest thing that I tell students is they freak out about the nursing application. They're like, oh my gosh, deep breath. It's the easiest part of nursing. fill it out to the best of your knowledge. You're not going to get docked points because you didn't fill it out perfectly. You have to submit transcripts with your application. You have to submit your essay. You have to submit your references. If you don't have those, then it's going to be an automatic no, okay? But you're not going to get an automatic no because you didn't put the right chemistry course that we're counting, okay? That's not how it works, not at all. And if when I'm scoring your nursing application, if I have questions, I email people, okay? So deep breath on that. It's the easiest part of nursing, easiest part. Do you have another one?
Yes, the HESI.
Mm-hmm.
Do you guys require it before?
No, we don't have the HESI here. We used to require it. We do use the HESI system all through the nursing program. So HESI is an online testing system. It supplements your coursework. And at the end of each semester, we test you on the knowledge of that semester, the content of that semester. HESI exams are set up just like the NCLEX exam because when you graduate from a nursing program, you have your Bachelor of Science in Nursing, but you are not a nurse yet. You have to pass nursing state boards, and those state boards are called the NCLEX exam. Once you pass that exam, then you are a registered nurse, RN, with a Bachelor of Science in Nursing, okay? So NCLEX, when you take HESI, those are very similar to how NCLEX is going to be. So you have all this testing experience all the way through the program of HESI tests because there's a direct correlation of how you do on HESI tests and how you're going to do on NCLEX at the end of the program, okay? So in nursing, or when you're doing your prerequisites, it's a lot of rote and a lot of memorization, okay? But in nursing, it's memorizing, but it's maintaining that content, applying it, and using your critical thinking skills, okay? So when you have a question in nursing, and you will have these on every single nursing test, all your questions, they'll be multiple choice. And of the 4 multiple choice answers, 2 will be right and 2 will be wrong. You gotta pick the best answer. And that is exactly how you're tested for NCLEX. So you have lots of experience. And we use that HESI system all the way through. Go ahead.
You said that you look at where we're taking our references are from, where the classes are. So do you take your students over?
No,
students,
not at all. Everybody's in one big pile, okay?
So isn't preferential over students that took classes?
So students who take their courses here, their prereqs, get extra points on their nursing application, point blank. Every nursing school does that. If you invest in their school and you do your prereqs there, they are going to give you extra points. Every school. Okay? This is my second nursing program. I worked in nursing for 20 years. Okay? That's how it works. So if you take them here, you get extra points. You don't have to though. You can take them other places. A lot of people have to take them at community colleges because of money. Okay? It's less expensive. But again, if you want those extra points, then you take your courses here. Okay? Does that answer your question? Yeah. But everybody is in one pool. So it's not like we say 90% of the students are going to be U of M-Flint students. That's not how it is. We look at your application very holistically. Again, everything matters in your application. And so we believe, and what we look for is we're looking for good nurses. So we tell students, if you have that minimum 2.75, and I'm going to go through all that criteria, if you meet that minimum, apply. Just because you're a 4.0 student doesn't mean you're going to be a good nurse, does it? Not at all. Not at all. So we are looking for good nurses here. Everything matters. Everything. Okay? So what other burning questions do you have before I get into my spiel? And you guys can interrupt me anytime. That's what you're here for. Questions. Go ahead.
I have a couple. So I was looking at the criteria, and then NCS 178, that's legal and moral decisions in nursing.
Correct.
I took HCR 487, which is another legal and moral class.
Here, correct?
Yeah.
I have to look at that because I know, so what happens is if you've had a course like that one, it would have to be reviewed by the faculty who teaches NSC 178, okay? But I'm going to tell you, just an FYI, most of you have had a legal, a moral, ethical course in your first degree, most of you, okay? We can have that reviewed, but I'm going to tell you more than likely it's not going to fly, okay? Our course, NSC 178, is specific to nursing at U of M-Flint. it talks specifically about the profession of nursing, the American Association of Nursing, their Code of Ethics, Scope and Standards of Nursing, where you would have not had that in just a legal or a moral general ethics course, okay? So I doubt that it's going to fly, to tell you the truth. Very, very, very few of those courses get evaluated. Most of the students have to take it. But one thing about NSC 178 is it's a 100% online course, and it's offered every semester, fall, winter, spring, and summer. So students like that, absolutely. But more than likely, you're still going to have to take that. But good question. Did you have another one?
I do.
Mm-hmm.
Yeah, I have a list. So I took Bio 168 in 2012.
Okay.
So I'm kind of getting towards the cusp of being
So
at that
it's a 7-year.
mark.
Yep, exactly. So you took it when in 2012?
Fall of 2012.
Okay, so it would expire the end of December 2012, 13, 14, 15, 16, 17, 18, 19. So it expire December 2019.
So if I'm in the course, if I get accepted into the second degree program, am I good? Or is your courses have to be 7 years from your application when you turn in your application. So from the application of the time you finish the program.
Correct.
Okay.
Mm-hmm.
And then,
So for those who have biology courses, A&P 1 and 2 or microbiology, and they're past the 7-year limit, again, they're 7 years from your application. If they're past the 7-year limit, you have the option of retaking the courses, or through the School of Nursing, we offer National League of Nursing competency exams, and they're $80 for anatomy and physiology, all anatomy and physiology, and $80 for microbiology. So you have to arrange them through me. They're online tests. You come in, I set you up, you take them, you get your score immediately. So if yours are over the 7-year limit, you have that option to take those.
is the NLN exam only for bio and microbiology?
Yes, it's not. We don't have a 7-year limit for any other courses other than anatomy and physiology and microbiology.
Okay, because I took nursing 209 back in 2012.
Yeah, doesn't matter.
So that's good for more than 7 years.
Correct.
Okay.
Yes, good questions. Excellent. Go ahead.
So, and just to clarify, no other classes other than the bios that have the
7-year limit. Correct. That is correct. Yep. Go ahead.
I have a question. So I will be done. The only outstanding prereq I'll have when my application is processed is microbiology. So I plan to take
Good
that
for you.
in the spring of 2019. So next spring, but it's not available here in the spring or summer semesters.
Usually it's offered every spring.
Is it available now? So as of right now, when I looked, it's not.
It's not on the schedule for spring.
Yeah.
Typically it is. It's always offered fall, winter, spring. But if to be safe, try and find it somewhere else just in case. But then if it's not, it just might not be on the spring schedule. I mean, that's spring 2019. That's a ways.
Right,
we're just
there is
getting to
time.
fall.
Yeah,
You know
so
what I'm
I just
saying?
wanted to
But
make sure.
typically it is.
Okay.
Typically it is.
But if I were to take that at another university, usually their registration for that is in early April, maybe earliest late March. So I wouldn't be able to prove that I'm physically registered for that.
Right, and all you'd have to do is put in there a note to say that you're going to register for it.
so
Yeah,
that
because
would
it does, on the application, it does state courses that you will be taking spring, summer. And again, I do understand that not all universities register as early as us. We register in November for winter, spring, and summer.
Right.
That's crazy, seriously. So I understand that. So you don't have to prove that to me. If you say that you're going to do it, I expect that you will do that. And if you don't, you're not in. It's that easy.
Perfect. Thank you.
You're very welcome. Go ahead.
Kind of going off of what she said, I have pathophysiology and pharmacology and the legal and morals this coming semester, and I'm applying for winter.
In the fall? You got a heavy load.
Yes. Yes, I do.
Heavy load. Yes.
Will that affect my application? Because I'm
No,
doing the application
no.
right now.
So for the accelerated program, we are now accepting twice a year. For many years, we only accepted one time a year, and that was students would apply to get in for fall term, okay? This past winter, 18, was the first accelerated class that we admitted in the winter. We admitted 24. Every fall, we always admit 40, okay? Then this coming winter that we're admitting 32, and then the following winter we'll go up to 40. We're gradually increasing, okay, to get those clinical sites. And I've lost my train of thought, what I was going to say. So when you, I do this all the time. When you apply to the nursing program, you only have to have 4 prereqs completed in order to apply. But it's different if you're applying in the fall or winter, so let me explain that. If you're applying now in the fall to get in for winter term, and you only have 4 prereqs completed by the application deadline date of September 14th, you have to be in the remainder of your courses in the fall. Because if you are accepted, then you have to start in January and all your prereqs have to be done, okay? It's a little bit different. If you apply in the winter to get in for fall, you have winter, spring, and summer to finish all of those prerequisite courses. So you have a little bit longer time, okay? And it's really not really possible if you only have 4 prereqs to do all the rest of those prereqs in the fall term. There's just really not a possibility. But as you said, you're doing Patho and Pharm and NSC 178. That is a heavy load. Even though NSC 178 is a 100 level course, it's a lot of work, so that you know that. It's an ethics course, always an ethics course. You have a lot of writing and a lot of work, okay? Anybody take? You're shaking your head. Did you take it already?
Took it in the spring.
All right.
Same.
But it's a good course. Did you not learn quite a bit about nursing?
Yeah, just a lot of writing.
It is a lot of writing.
A lot of repetition, but yeah.
Yeah, absolutely. So you're gonna have that, and then Patho, and then Pharm is a hard course too. So just pull up your bootstraps, you know what I'm saying? Put the pedal to the metal, you can do it, absolutely, yeah. So as I was saying, we accept twice a year to this program. We typically have anywhere from 75 to 125 students applying for those seats, okay? So you have a decent chance of getting into the program. You always have to ask that question when you're applying to nursing schools, because
How many did you say wasn't accepted? And
40 are accepted for fall, and then in this coming winter it will be 32, and the following winter it will be 40, okay?
And how many applicants usually?
Anywhere from 75 to 125, so again, you have a good chance. There are many schools that have many more applicants. I have a very good friend that works at the University of Tennessee, Knoxville. They have 900 apply for 125 seats, 900. That's a lot. And again, what does the media tell us every day? Where are the jobs?
Nursing.
In healthcare and nursing specifically. Again, you can go anywhere in the world, get a job, have a guaranteed job for life with nursing. And the opportunities, unlimited, unlimited. You could say, I'm going to graduate and I'm going to go be an ER nurse, and maybe you do that ER nursing for 5 years because you like all that fast-paced stuff, and you're like, I can't do this anymore. Look at all the other places, not just only in the hospital, but outside the hospital. Again, you could be in the community. You could work in a church. You could work in a school. You could work in a public health department. You could work in a jail with prisoners. You could be a researcher. You could teach. And the list goes on and on and on and on. And that's why so many people are coming back to nursing, even though they have a degree in another field, is because the opportunities are unlimited, unlimited. And we are all getting older, including myself. And all those baby boomers are getting older, okay? There's a shortage of nurses, and that's projected until the year 2025. So lots of people going into nursing. So the 4 things that we look at here to get into our program, and every program is different. We don't interview here. A lot of schools interview. We don't. So we look at prerequisite GPA. You have to have a minimum 2.75. We look at last 30 credit GPA, minimum 2.75. You have to have an essay. You have to complete an essay, and you have to have 2 references. One academic and one professional. I'll not go into detail of all of these. So of the prerequisite courses, you will see them listed here on this sheet. It's Anatomy and Physiology 1 and 2, Developmental Psych, Microbiology, must have a lab, Chemistry. So we've changed the chemistry requirement. You used to have Chemistry 252, which is biochem, to start this program. And then in order to get into biochem, you had to have general chem. We've changed that now. You only need a chemistry course, and that chemistry course has to be Gen Chem or higher. So Gen Chem here at UM-Flint is Chem 150, 151, that or higher. So if you've taken chemistry courses in your previous degree and you transfer in organic chemistry or biochem or whatever that chemistry, as long as it's transferring as Chem 150 or higher, you're good. And you have to have a lab. Make sure you have a lab with it too, okay? Pathophysiology, nutrition, pharmacology, and legal moral decisions. Those are the prereqs. You all have a previous degree, so you don't have to worry about general education requirements. Those are completed in your first degree. The only thing you have to complete are prerequisites and then the nursing curriculum right here. That's it, okay? It is a 16-month program, very, very intense. What our traditional students do in 2.5 years, we're doing in 16 months for you. We're not getting rid of any courses, all the content is the same, but we're condensing in 16 months. So you start either fall or winter, so if you start in the fall, you do fall, winter, spring, summer, fall, and you're done. If you start in the winter, it's winter, spring, summer, fall, winter, and then you're done. Okay, so very, very accelerated program, very rigorous. Nursing programs are rigorous in general, no matter if you come here or anywhere else, but this is condensed. There are some accelerated programs that do it in 12 months, and I'm thinking, oh my gosh, ours is 16 months, ours is really crazy. I can't imagine doing it in 12 months. I can't imagine, okay? We tell students that, and a lot of students, I've gotten emails and questions like, I have to work a 40-hour job, can I still do the nursing program? That is not possible. You can't work a full-time job doing this. We tell students, especially the accelerated students, if you don't have to work, don't, okay? But we know most of you do. Work as few hours as possible because you're going to be working very hard in this nursing program. And the expectation is much higher in the program. You have your theory, okay? And you're going to class, but on top of that, you have clinical, and you have 2 or 3 days of clinical a week. On top of you have your reading. You're never caught up on your reading. You have research papers, you have care plans for every single clinical course. You have a care plan that's anywhere from 25 to 50 pages long, and that's at the end of the semester. There's just a lot of work. You have group work. Lots of work to do in nursing. Okay. We want smart nurses by our bedside, correct? Taking care of us? We do. But nursing is just in general rigorous, okay? So if you don't have to work, don't. But if you do, very few hours, very few. Go ahead.
Do you all have evening courses for those of us who are working in the morning?
No, we do not. So what we tell students is your life has to be flexible because nursing school is not. We have to coordinate all your courses and your clinical so everything works, okay? And we have to take those clinical wherever they might be, what the hospitals give us, okay? We can't say, oh, these students can only take nighttime clinical. We do have clinical. Clinical can be Monday through Sunday, and it can be first or second shift. So you could possibly get a second shift clinical, okay? We don't have any third shift clinical right now, but that's not saying when you get in, we might. And I always say it's dog eat dog for clinical sites because we're not the only nursing program in this area. There's a lot of nursing programs in the state of Michigan. Mott's in our backyard. Saginaw Valley's not that far. OU's not that far. OCC's not that far. Michigan State's not that far. Detroit Mercy's not that far. Did I say Saginaw Valley? Lots of nursing programs. Lots. Okay? So we're all competing for those clinical sites.
How far do you go out to run the state for clinicals?
So we tell students that most of your clinical will be in Genesee County, most, not all. We tell students 1 hour from UM-Flint you can have clinical. So we do have some for accelerated students. They are doing community health in the fall, and they're doing one of their community health clinical sites is Lansing. So I have a student that lives in Metamora, and she's like, she got that site, and she said I have to drive an hour and a half. But I always say to students all the time that it's 1 day a week for maybe 10 weeks because you have less clinical hours for community health, okay? So that is very doable, very doable. I live a distance away. I live in Bay City, drive to UM-Flint every day. 45 minutes here, 45 minutes back, 5 days a week. If I can do that, you can go to a clinical 1 day a week, okay? So again, it just depends on those clinical, where we get them. We've had clinical at Detroit Mercy, or not Detroit Medical Center. We have, for the first time ever, we have students going to Beaumont, Royal Oak for peds this semester. So we are branching out on those clinical sites. So not everything is Genesee County. We do use Hurley, McLaren, and Genesis. Those are big hospitals that we use, but not everything is hospital-based, okay? When you're doing community health is nursing in the community. So again, that could be in a church, could be in a school, could be in a public health department. We have students going to McFarland villages here in Flint. We have students that going to New New Oakland and Clarkston, and in Flint also. So is somewhere in the community. Same thing when you're doing mental health in nursing. Hurley and McLaren do have mental health units, okay? But they can't accommodate all of our students. So we have to go, again, we have to go to Detroit Medical Center for some of those, and some other places, okay? Good, excellent questions, really good questions, guys. So, any more questions in regard to that? I'll talk more about that. Go ahead.
When do you start clinicals in
the second week, the very first semester. It's not a program where you're in it for a month or two or a semester and you finally do a clinical. That second week, you are in the hospital setting, you are taking care of patients with the oversight of your clinical instructor. All 40 of you, or however when you ever get in, 32 or 40, you will all be in the same classes together. That's your family for 16 months. But when it comes to the clinical setting, it's not 1-to-8 ratio, and the state mandates that. 1 clinical instructor to 8 students maximum in a clinical setting. Go ahead.
Do you have the same people within your clinical settings through like?
No, you're mixed up every single semester.
And then in like the case of, I know this happens with the like traditional program. If like a family emergency or something happens, you have to take time away from that semester you can pick up later on. Is that available for the accelerated as well? Yeah, some students do that, but and now it's much more readily available because there's a cohort behind you, because we have a winter and a fall. Before, when we just had fall, they'd have to wait a whole nother year. Right. But yes, the road of life is not one straight road, right? It's many curves and bumps. So sometimes there are things that happen in life where students do have to stop out. And that happens every single semester. So yes, you are allowed. You have to petition. You have to ask permission. But majority of the time, those are approved. Absolutely. Yep. Okay. And then how long are you? Most of the people ask for, a semester. I need to stop out a semester. But you can't stop out any longer than a year, because then you lose your nursing knowledge. Yeah. Okay. Good question. Yep. What else, guys? I've got a whole bunch more to tell you. Go ahead.
For the checklist of like once you get in, like the CPR, I have mine through the hospital. Does that?
No, it doesn't matter. Yeah. And what we do is don't panic on that kind of stuff. We have an orientation, and if you looked in the nursing application, you saw that it says mandatory. It's a whole day orientation. We're talking about everything you need to know, and we tell you what's required, and then you go and do that. And people who are already CPR certified, it has to be a specific course. It has to be for a healthcare provider. It can't be me taking it Joe Schmo on the street. I'm not a nurse. I always say I like to play one on TV. People think I'm a nurse because I work in nursing. So it can't be just regular Joe Schmo. It's got to be a healthcare provider course. So we tell you what specific ones. But again, if you're already certified through your work, that's absolutely fine. Okay. Absolutely fine. Good questions. So let's go back to the prerequisites. A couple big tips I'm going to give you guys is science GPA there's not a requirement, not a minimum that you have to apply to the program, okay? But science GPA is heavily, heavily looked at. It is calculated, and those members of that committee, they see your science GPA. And the reason they do that is everything in nursing is research-based or evidence-based practice. There's a tremendous amount of research that shows students who do well in science courses are going to do well in the program. And that's what we're looking for. There's no magic formula. We're looking for people who are going to get into the program, be successful all the way through, graduate, pass NCLEX first time. That's what we're looking for. We have a very high, did I say this already? I always forget what I say to the first group. We have a very high pass rate for NCLEX in the mid-90s. That's a very high pass rate for first time taking NCLEX. Very high rate. We prepare you for that test. Go ahead.
Do they look, because I was a pre-med student, so obviously I took a lot of chemistry, but I also took a lot of biology. My biology classes are fantastic. Chemistry is where I struggled.
Well, when we're looking at science, we're looking at the only science GPA is the science GPAs of your prereqs.
So not all science classes, just those. Okay. That works.
That works, she says. That works. Yes, we're not looking at all science courses. Yes, we see that, okay? We see that. But anatomy and physiology is very important, okay, compared to chemistry.
With the chemistry, you take the course with the highest.
Right, and for chemistry, thank you. Pipe in anytime, girl. And I didn't introduce you, did I? I am so sorry. I'm going to, in 1 second. I'm just babbling on. For chemistry, many students have taken several chemistry courses. So for your nursing application, we're going to use the chemistry course that's the highest grade for you, lecture and lab. Doesn't matter if it's organic or bio or whatever. It just has to be higher. It has to be Gen, Chem, or higher, okay? And you guys, seriously, like Chelsea's here, we're a team, and I just forget that she's here. So Chelsea Smith, this is Chelsea Smith, she's the advisor in the Student Success Center. Even though you guys have a previous degree, you are still considered pre-nursing students because you're not admitted to nursing. So Chelsea is your famous advisor. Seek her out, make an appointment with her. You don't have to physically come in and see her. She can talk by phone, by email, by Skype, whatever you need to do, whatever is most convenient. But all pre-nursing students, again, whether you have a degree or not, see Chelsea, and then once you're admitted to the program, you're mine. She does have cards here, so when you guys leave, you can take a card. But Chelsea and I work as a team. She only sees pre-nursing students. She knows what she's talking about. If she doesn't know the answer, she emails me or IMs me. We have constant communication all the time, okay? So seek her out. She's very knowledgeable. Go ahead.
Can we make appointments with you now, today?
Go to the website. I'll give you my card and there's information on there. But go to the website and you can request an appointment with me. My schedule is really very busy because of the time of year it is right now. But we will find time for you in the schedule.
Right. And Chelsea has a big load. There are 1 million pre-nursing students at this university, at every university. So you have, what, 500 or more?
It's closer to 600.
Okay, there you go. That's a big caseload, yeah. But she will fit you in. Go ahead.
Question. My mom went through the nursing program at SC for 3 years ago, so I know this was a problem, and kind of looking at this, it might be around being a full-time student, getting the loans and stuff, being a full-time students, but these aren't full-time credit semesters. Is there...
You mean in the program they're not full-time?
No,
or doing prereqs?
No, within the program, like there's...
The last semester.
Where you, okay, so let me explain that. You guys already have a previous degree. So if you were a Pell student getting free money from the federal government, you can't get Pell as a second degree student. So that's already wiped out, okay? For Pell, you have to be full-time. Most of you are only going to be getting subsidized and unsubsidized loans from the federal government, okay? To get loans from the federal government, you only have to have 6 credits to get the full amount. You don't have to be full-time. Nursing doesn't expect you to be full-time. You don't have to be, okay? So all of these, you would meet that minimum 6 credit criteria. Does that make sense? And I have to tell that to students over and over and over. They'll email me to say, Vicki, I need another class. And I'm like, tell me why you need another class. What type of financial aid are you getting? Because I'm not going to put you in another class and pay for all that when you don't need it. If you are taking 6 credits, you will get the full loan amount if you're taking out loans for subsidized and unsubsidized loans. Okay? Yep. The other thing too that you have to be aware of as a second degree student is if you've maxed those loans out in your first degree, bless you. If you've maxed those loans out in your first degree, you're not getting more money in your second degree. So if you're in your first degree, depending on your age and your status, so if you're a dependent student, meaning you're under the age of 24, okay, you're not married, you don't have any kids, you are a dependent student. The maximum you can take out in loans is $31,000. If you're an independent student, age 20 over to age 24, or if you're under 24 and are married or have a child, then you're an independent student. The maximum loans you can take out as an independent student is $57,500, okay? So if you are an independent student, $57,500, and you have taken out $40,000 in loans in your first degree, you only have $17,500 remaining. You can't get any more than that, okay? So you're gonna have to seek out private loans, find your rich grandma, go to the money tree in your backyard, whatever that might be, okay? But you're gonna have to find that money and make sure that you get it now because you don't wanna start the nursing program and not get halfway through and don't have any money, okay? You don't want that to happen at all. So it's a delay start of a year. And students, I was like, I'm 25 years old and I gotta get in this program as soon as I can. And I would say, 25 is young. Even if you graduated when you're 30, you still have 40 years to work as a nurse. So take your time, do well in your courses so that you get that guaranteed seat so that you can get through nursing school. Don't rush it and get poor grades and not be able to get in, okay? So look at the big picture. Go ahead. Go ahead.
How much is the
Program? Good question. So with tuition, scrubs, immunizations, all of everything that you need, it's anywhere from $32,000 to $35,000, just the program. That's not counting prerequisite courses, okay? But that's, I don't think, I mean, that's still a lot of money, okay? But I actually don't think that that's that bad for an accelerated program at all. I don't think, and you have a University of Michigan degree. I don't think that's bad at all. And when you graduate, you have the resources to pay that money back. Yes, go ahead.
Can you talk a little bit, are you going to talk about the MSN degree?
Yeah, I will. Yes, absolutely. Yeah, thank you. Yeah, I will. But go ahead. Go ahead.
Because I'm a public servant, my first degree, that I was eligible for a program.
No. Okay.
So does that count?
If you didn't take out any loans in that, no.
Did you have your previous loans forgiven?
Forgiven?
In the public service program?
Well, I'm still in the program.
Okay. Okay, so they do they forgive those loans? Because you're, oh, they do?
The only thing I was responsible for was my private loan.
Okay, then you're good.
So I could,
right?
Well, if you haven't completed the contract, if it was a 5-year or 10-year contract, if you haven't completed
No, it's not
that,
done yet.
it's not done yet. So you're going to now take out additional loans on top of that. So you haven't completed the contract, so those loans are going to be counted in that 57.
They will? Okay. Okay. So just be aware of that. Students don't realize that if they've maxed out, they think they can get still more loans, but you can't. Even though you're seeking a second degree, you're not getting a master's degree. Master's degree, again, it would be, that starts new, and you get $20,500 a year if you were getting a master's degree, but you were getting a second bachelor's degree. Okay, so just look at that. And our financial aid office is phenomenal. There's some really good people that work there. They're always willing to help you. You can meet with them at any time to talk about your financial aid. And they can look up what you have in loans so far and how much you have left. They can do all of that for you.
And I can show you a little bit too. If you were to make an appointment with me, I can show you where you can see the loan amounts you've already taken out to kind of start that conversation.
Right, right. So you were talking about the MSN program. So we have a fairly new within the last couple years. We have students that can apply to the Accelerated Second Degree program and at the same time apply to the Early Assurance MSN program. So you apply at the same time, but you hear first if you've gotten in the accelerated program, and then you don't hear if you've gotten the MSN program until that first semester of the nursing program, okay? So the Early Assurance MSN program is a guaranteed seat in the MSN program. So you do 16 months of the accelerated program, and then you do 20 months of the MSN program. So in 3 years, you are a family nurse practitioner and NP. Good gig, absolutely really good gig. So it varies. So if you apply and you are admitted to the nursing program in the fall, you do fall, winter, spring, summer, fall, you graduate in December. The MSN program only starts in January. So you would graduate in December and then start the MSN program in January. And you have 30 or 60 days to get your RN license, okay? Or you don't continue in that program, okay? You're going from very accelerated to very, very accelerated in the MSN program, okay? So then if you apply to get in the program for winter, you're in the program winter, spring, summer, fall, winter, you graduate in April. Again, MSN program only starts in January, so you would have from the end of April, you'd have May, June, July, August, September, October, November, December to pass your boards, you can work as a nurse, and then start the program in January. You have the option of going part-time or full-time in the MSN program. So we accept up to 15 students who apply to the accelerated program. We accept up to 15 students in the MSN Early Assurance program.
How many people normally apply to that?
The MSN program is extremely competitive here, extremely. They don't have even close to the seats who apply. But some people who don't get in the AS accelerated to MSN program, they graduate and they're like, well, I'm going to work for a little bit and then I'm going to apply to the MSN program. Doesn't mean that you can never apply to the MSN program, but I think they only accept maybe 35, 40 in the MSN program. That's it.
And
That's it.
15 are the early practitioner?
If there's good quality applicants, up to 15.
Up to 15, and how would you, what would you recommend doing to try and
So the criteria, what they look at for the MSN program, so we look for the accelerator program, we look at your prereq GPA, your last 30 credit GPA, your references, and your essay. For the MSN program, they're looking at your GPA from your first degree. They want that degree to be in a science field, biology, chemistry, exercise science, something like that. It's not saying that you can't apply if you don't have that, but those people are going to be given priority, okay? And then they want a minimum of 3.5 cumulative GPA in your first degree in order to apply. Again, doesn't mean that you can't apply if you don't have the 3.5. You still can, but priority is going to be given to those students who have science backgrounds and higher GPAs, because the accelerated program is very intense, but that MSN program is very, very intense, and you are going into an MSN program without any experience as a nurse. You have clinical, you're in nursing school, but you're coming in without any experience.
Is there other things you recommend doing? Like if you already have the 3.5?
Yeah, there's nothing else that you can do. That's what they're looking at. Yep, that's what they're looking at.
Just high science.
Yep,
Okay.
yep, that's what they're looking at. So do you qualify? Yeah. Are you saying?
I qualify for the minimum, but
Uh-huh.
I'm wondering, there's
Yeah.
got to be a lot of people that have 3.5s that also don't get it.
Yeah,
So.
it's the accelerated program is more competitive than our traditional program, much more competitive, much more. Go ahead.
The accelerated MSN program is more competitive than
The accelerated program for undergrad. For undergrad is much more, yes. But the MSN program is very, very competitive, yes.
And then is the MSN, I was reading into it and a little confused. Is the MSN program, is that?
Nurse practitioner.
Right,
You-
yeah. No, but is it accelerated as well?
Yeah, 20 months.
Okay, and what is the usual? How long does it usually?
It depends on the school, you know what I'm saying? Depends on the school. It could be anywhere from 2 to 3 years typically, you know what I'm saying? But 20 months is pretty intense.
Yeah.
And you have to get a lot of clinical hours in for those. Yeah, but again, it's a good gig. If you have that guaranteed seat and you go right from the ASD right to MSN, I will tell you that a lot of students have that seat and they're very excited, but they get through the accelerated program and they're like, oh my gosh, I can't do any more of this. So you can defer, you can go part-time in that MSN program, you have that choice. I have very few students who actually get out of the ASD program and go right into the MSN program full-time. Rare, rare, rare. Most people go part-time, at least part-time. Because again, when you finish, you want to work as a nurse, you want to get some experience, correct? And it's very, very hard. Like most people who go right into the MSN program full-time, they're working just occasional, that's it. It's just too difficult to work full-time doing the MSN program.
So how many applicants apply for the traditional nursing program then, if you said between 75 and 100?
Anywhere from 50 to 75, 50 to maybe 100. And you as students, because you have a degree, doesn't mean you can't apply for the traditional program. You can. It just depends on what's best for you. There are a lot of students who have families and they're working and they need to work during spring and summer for full time. That's perfect then for you. You apply for the traditional, you only have fall and winter courses, you don't have anything spring and summer. It doesn't mean that you can't. And a lot of people apply to both, just to be on the safe side. It gives them an extra cushion. And so some people get into both and they get to choose. Some people get into one and not the other. But be aware, there's one course that is different, prereq. It's Nursing 110. You have to take Nursing 110. It's not a prereq for the accelerated, it's a prereq for the traditional. You have to take Nursing 110 in order, if you are going to apply to both programs. Nursing 110 is only offered fall and winter. It is not offered spring and summer. So students will apply, and they'll say they want to apply to both, and I'll look and they won't be in Nursing 110, they have not taken it, so that automatically gets them out of that pool.
And then if you apply for the traditional nursing program and with the same circumstance, like a family issue comes up.
Same thing. You can step out. Yep. You can
have a
step
year
out.
to come back.
You have a year. Yep.
Okay.
Yep. You had some questions too.
If you don't get in
Mhm.
the MSN program right when you apply, do you have to reapply?
Yeah, you have to reapply. Yeah, absolutely. So when you graduate, work as a nurse, get some experience, and then reapply to the MSN program. Yes. Doesn't mean that you're never going to get in. You just have to reapply. You have to reapply. Yep.
How many people usually apply to
I couldn't even tell you, to tell you the truth. I know there's a lot, and they have very few seats. That's one of our popular graduate programs. I advise undergrad students and I'm involved in all the application, but I would have to ask my colleague in regard to that because I don't know. I don't know. Because we have a grad advisor, undergrad advisor. Yeah. I wish I could give you that answer. Sorry.
It's all right.
Yeah. What else?
I have a question on the 3.5 GPA. Would they take anything into account, like the prereqs you've taken to get into the accelerated program, to kind of factor in your GPA, or would they just take it strictly from what your undergrad?
Well, the GPA is your undergrad, but they do look at all of that stuff, where your sciences, what sciences that you've taken, where you took patho, what grade you got in patho. They do look at all that too. Yep, they do. So you guys have great questions. I love when I get so many questions. Sometimes I have these sessions and hardly anybody ask anything. So the 4 criteria for getting into the program then are prereq GPA, 2.75. In each of these prerequisite courses, you have to have a minimum of a 2.3. With the exception of chemistry, you have to have a 2 point. But when you apply, if you turn in your application, based on that application deadline, you have to have a minimum 4 prereqs completed. Of those prereqs that you have completed, you have to have a cumulative GPA of 2.75 amongst those prereqs, okay? So 2.3 in each, but again, the higher the GPA that you have, prereq GPA, the stronger your nursing application. The more prereqs you have completed, the stronger your nursing application. If you have pathophysiology, here's another big tip for you. Pathophysiology, NSC 207, is the most important class for applying to our program. The most, okay? That information, that knowledge that you gain in that course is knowledge you will use every single day in nursing school and every single day as a nurse. It's that important. Our program is very, very heavy patho focused, and so students will say, we'll sometimes have a nursing panel at orientations, and they'll say, what's the #1 tip that you'll give us? And they'll say, know your patho, know your patho, know your patho, okay? So taking it here puts you in an advantage, it gives you an advantage for nursing here. If you take patho, that definitely increases your chances of getting in here. We have 2 amazing faculty, and I'm not just saying that to say it, 2 amazing faculty, seasoned faculty. You're already shaking your head.
I just took it in winter.
You had Margie?
Yes, fantastic.
Fantastic. Fantastic. She's amazing. Yep. She is a seasoned nurse. She is so smart. Oh my gosh.
And passionate about it too.
And passionate.
She's like, you guys got to be my angels for all these different conditions.
Yes,
like
absolutely. She's amazing. And then Dr. Turkelson teaches it in the spring. She's amazing. She's a mini Margie. That's what I call her. Excellent, excellent instructors. So I encourage you, take it here. You will get extra points because you've taken it here. Absolutely. Okay. Excellent instructors. Go ahead.
And there isn't a lab with that one, right?
There's no lab for pathophysiology. No, not at all.
I just know it was at Albion had a lab. So.
Okay. Okay, so that is the most important class. When we're reviewing applications, that's the first thing we look at, where you took it, if it was done, if you had to repeat the course, okay? Students always ask me too, can I repeat courses? Of course, this is life, things happen, okay? The more repeats, the less chance that you're gonna get into this program, but we understand this is life, things happen, okay? You can tell us why you've repeated a course on your application in the essay portion. You can tell us why, we look at all those things, okay? Do we have students that get in with repeats? Absolutely, absolutely. But the more repeats, the less chance you have, okay? Go ahead.
I had a couple questions. I want to get them out before I forget.
Go ahead.
So the first one applies to what you were just talking about do you look at repeats because the class has expired, the 7 years?
No, that's not considered a repeat.
Okay.
Mm-mm.
And piggybacking on that, the anatomy and physiology classes I took at Mott, as you said, to save money.
Yeah, 151, 152,
yes.
yep.
And I took the first one, I took it there the first time, and then just recently the past fall and winter. So that transcript is sent here. So do I need to get that transcript as well? I thought though getting a transcript is unofficial, so you don't really want to turn an unofficial transcript in with. You
have to send official transcripts to the university to undergrad admissions. They have to get those courses on, yes, absolutely. With your nursing application, you also have to submit transcripts. And they can be unofficial or official. So let me say, so if you go online and just have those officials sent to your home, just don't open them. It's that easy, okay? But unofficial might be, you might be a student at Mott. You go to Mott to say, I need a student copy. at their register, they would print it off, they'd put it in a sealed envelope, it would be in a MOT envelope, and they would put a stamp over that seal. That's an unofficial. You can't go to your student account, print off a transcript, put it in an envelope, you can't do that, okay? That's what we mean by unofficial. It still has to be in that official envelope.
So as long as it's an official sealed envelope, that
Yep.
will count as the transcript you're looking for.
Yep.
And for, I think I read it, I don't know if I read it correctly, we do not need a transcript from here?
Correct.
Okay. That's what I
Correct.
thought.
You do not need a transcript from here. Yep. Excellent questions.
Like back when I was in high school, I dual enrolled, and so I have my MOT transcripts. But I've applied for, like, back in 2014 and 13, I applied for the undergrad traditional program. Do you guys still have that, or do I have to go get it? How much of my stuff do you have? Like,
In
I
the
have-
undergrad admissions, I don't know how much they'll have. You'll have to ask them. But
Okay.
you have to reapply to the university, okay? And we need every transcript from where you attended school, even if it was a 1-credit class 20 years ago during spring and summer,
Yeah.
because that's academic dishonesty if you don't submit that,
Right.
okay?
So it would just be kind of like, we would have to like literally go through my file, like private meeting and go through.
Yeah, you would have to contact admissions to say, I applied before, do I have to resend everything? I'm thinking you will,
Yeah.
but I'm not.
Admissions will flag it because they use the clearinghouse to make sure you have been honest, so.
Okay.
Yeah, so it would just be an admissions question.
Okay.
Yeah.
So it's okay to have a bunch of different envelopes, sealed envelopes
Yes.
in your
Yes.
final
Yeah,
packet with your
absolutely.
references and
Yeah.
everything?
Yeah.
Okay.
It's one big envelope with everything in it,
Okay.
and we tell you don't staple it, don't fold it, don't paperclip it, don't do anything. Have everything loose because we got to take all that apart anyway. Put an envelope, all those little envelopes go in there. Yeah, simple.
Is it not online?
It's not. It's not. You can mail it in. You can print everything in, put it in, mail it in. We had hoped to have it online for for those applying now to get in for winter, and we've just been so crazy busy that we've not had a chance.
It might be by the time you decide to.
Yeah, it will be online in the near future. Absolutely. Yeah. Yeah.
Another question. You talked about not physiology at Michigan State won't.
Oh yeah, for your PSL. So you only took. Tell me which one that you took.
310.
That's all that you took, correct? You didn't do the
310, and I was going to take anatomy and physiology this semester.
here,
First one.
A&P, like Bio 167 here.
I was
Where are you gonna?
take it at Wayne State?
Oh, at Wayne
The
State.
first anatomy and physiology.
Okay.
one.
So is the I can't remember PSL 310. Is it anatomy and physiology 2 or
It's
just physiology?
physiology.
Okay. So you need to take an anatomy course, not A&P 2, because it is different. You need to take an anatomy course with a lab.
Okay.
Wayne State's is only one semester anyway.
Yes, Chelsea came from Wayne State.
Yeah. So what do I need? Right now I'm signed up for anatomy and physiology at Wayne State.
So you need
It's
an
one class.
anatomy course, not an A&P 1.
You'll have to find an institution that splits them into.
Right.
anatomy.
So anatomy and physiology can be offered 2 ways. They can do A&P 1 and A&P 2. So you get anatomy and physiology, and they cover so many body systems in A&P 1. And then there's A&P 2 where they cover so many body systems in A&P 2, anatomy and physiology. Okay. Or it's offered 1 whole semester anatomy and 1 whole semester of physiology. You've already had the physiology part. You need the anatomy part. So you need a 1 semester anatomy course.
Will you guys accept the physiology? I didn't take a lab.
As long as your anatomy has a lab.
Then so I just need anatomy.
Anatomy, not A&P 1 or A&P 2, an anatomy with a lab.
Okay.
Does that make sense?
Is there a class here?
So I would have to take just an anatomy and ask you
A
guys.
4-credit anatomy course with a lab.
Yeah.
Okay.
And there are
Well,
offered.
what happens if I took anatomy and physiology at Wayne State?
It doesn't transfer.
It won't transfer you.
No,
It
this is a
says
6-credit. Does it say it in the?
Thank you.
612?
Is it?
I'm gonna check it right now.
Oh, okay.
Wait, can I ask you something, because I'm faculty at Mott?
Oh!
Your R151 and 152,
Transfer is 167, 168.
wow.
I was gonna ask that.
They do have to do the lab, the L with it too.
Yeah,
Yeah.
gotcha.
Mhm.
'Cause They need that, well, what if she did that?
You can.
just take both.
But
of
she'd
them.
have to take both of them.
Yeah, because you've had the physiology, but they offer A&P 1 and A&P 2.
But she'd need both
Yeah, but
semesters of
to apply
that.
to Wayne State's accelerated program, I need anatomy and physiology from them.
Yeah.
So I would have to take their anatomy and physiology plus an anatomy.
And that's what I'm saying. Every nursing program is different, and so we're not all unified, and just because you take the course here doesn't mean it's going to transfer to us, but it might be work for somebody else. That's the unfortunate thing with nursing. If you're looking at applying to more than one program.
Don't you think I should? Because you just said it's a 40% chance to get in here. That seems not, because you said if it's 75 to 125 people and 40
get in, 40 get in.
That's like,
but there are people that don't take any course. Well, there's a couple courses that you have to take here. NSC 178, you have to take that here. It's specific to nursing here. Yes. But there are people that get into our program that have one course here. No, it just depends on the applicant pool.
It was that the chances of getting in are only 40 to 50%.
Well, we only admit 40.
Yeah.
And 75 to 125 apply for those seats.
So do you all...
So I was just saying that I'm looking at other programs also.
Yeah, that's smart. That's smart.
That doesn't sound very high to be 40 to 50% getting in.
Yeah. I think you have a very good chance, because if you're looking at other schools like a Michigan State, there's like 500 apply for 25 seats.
So Wayne State's anatomy and physiology course comes over as Bio 167 only. It's a 5-credit anatomy and physiology course. And so it's not the equivalent of like the 8 credits of 2 different courses that we learn.
I did see that. So I saw that it does count for 167, and then I saw that Wayne State's physiology class counts for 168. So I thought maybe Michigan State's physiology would come for 168.
Okay, so you're talking about...
Like I looked to see
MSU's
if I took...
physiology shows up as 168 in our...
No, Wayne
no, it doesn't.
State's physiology shows up at 168. Sorry.
They do have a physiology through the kinesiology department. Is it kinesiology?
I'm not sure if it is. I just saw that Wayne State, to take the first class and second, would be anatomy and physiology. And
what I'm going to suggest is that you get with Chelsea. Yeah, exactly. So I can finish answering. So we can figure that out. No, it's okay. Absolutely okay. That's what you're here for. So we can figure that out, what's the best situation for you and what we're going to accept. Because if it's not in the transfer database and it's not coming over, then we're not going to count it for nursing. It has to transfer as the equivalent courses. But again, if you've taken, I know Michigan State's courses, and we have it worked out with the biology department, they're not going to accept it, but nursing will. We've reviewed those courses as long as one of them had a lab, okay? So there's little idiosyncrasies that Chelsea and I know about, but you all might not know about. So you need to get with Chelsea to figure that out, what would be the best situation for you.
Set that appointment up.
Yeah, yeah.
Thank you.
So.
On that same note,
okay.
I don't have mine at the transfer date.
And I want to show you that.
It wouldn't come up. So for someone who wants to take those prereqs at mine, how do you know which one?
So there is a transfer database that UM-Flint has. So what do you teach at Mott?
Dental hygiene.
Oh, okay. Very good. Yeah. There we have an amazing transfer database. You can find out almost any school in the entire United States, community college, university, if it transfers. That I'm going to show you guys, because my accelerated second degree students always have issues, okay? They think like, oh, I took anatomy and physiology, that will count. No, it does. It has to count as the equivalent course. It's just transfer.umflint.edu. Everybody has access to this database. Everybody. You, me, I use it as an advisor. Chelsea uses it every day, okay? So you can click on this for the school, or you can type in the school, okay? You can do Wayne State. Click on Wayne State University, okay? And then it shows you all the courses that transfer. But if you're looking for a specific course, okay, so maybe you want to know Bio 167. So it gives you have to take 287 or 2870, the numbers are now 2870, to equal Bio 167. Has to transfer as the exact prereq number, or it does not count, okay? That's what you're looking for. So anybody has access to this. So let me go back here though, and I want to show you. So if a course, I'm just throwing this out here. See how some of these courses right here, they're coming over as 3XX, 4XX as department credit. That means it's coming over just as department credit. It's not coming over as the exact prereq that we require for nursing. If it comes over as department credit, I can't count that. It has to come over the exact numbers. Now, if you've had a course, and let's say anatomy and physiology, you took 4 credits of anatomy and 4 credits of physiology, but it's not in the transfer database, you can go to the biology department and have that reviewed. That you have to send the syllabus, the course description, and an unofficial transcript showing that you completed that course. They look at it, and then they'll send you back an email, and they'll copy me to say, these courses will fulfill Biology 167, 168. I respond and say, we will accept those. So you can have courses reviewed by the specific department. So if it's biology, it's biology. If it's chemistry, it's chemistry. If it's psychology, it's psychology. But when you send the syllabus, it has to be from the specific semester that you took the course. Okay? It can't be you took the course in 2010, but now you're sending a syllabus from 2018. The course could change dramatically in that time. Okay? So you have to, every school is required, if they're accredited, to keep syllabi for so many years. So if you don't have that syllabus from that semester, you can call up that department at that school to say, I'm looking for Biology 171 at Mott from this year. They will be able to send that to you. We get those requests all the time. We have to, it's required that we save those, okay? So, just letting you know, use the transfer database, make sure your courses are transferring, utilize undergrad admissions, utilize Chelsea, that's what she's here for, to help you, okay? Because I scored too many applications where I'm like scoring and they're like, oh, I did this and this, and I'm like, not transfer, not transfer, not transfer, can't count, can't count, can't count, okay?
There's a mix and match issue too. We can't mix and match different courses, much like what we were just talking about. So make sure you put Mott on there, the bio courses. You have to take both anatomy and physiology courses at Mott. You can't take the first one there and then try the second one here.
Yeah, that's,
it has to be at both.
And at most institutions, you have to take A and P at the same institution for them to transfer.
So you can see you have to take both 151 and 152 to get credit for both.
167, 168. Oh, but no, that's new now. That's new. Biology just did this. This is new. This is, I know they were working on that. They were working on that.
So they
yeah.
151 for 2.
Yeah. So let me look at 168. That will be. Oh, now that's only look at 152 is showing. No, it's not showing it.
They'll only give you credit for 168.
They'll only give you
for both.
Yeah. So 151 will transfer as 167, which that's a good thing because then if students want to take 168 here, that's a good thing. Yeah, that works out good in the system. And then if you take 151 and 152, you get 167, 168 credit. So that's a good thing.
That's great for Mott.
Yeah. Seriously.
It is.
Yes.
Yes.
Yeah.
That's why I took them there.
Mm-hmm.
And I knew they transferred the first time, so that's why I went.
Well, before.
Why don't they have the L by those? That you have to have
I know they don't have the L, but the L is
Yeah,
needs to be
is
there.
required. Yeah, exactly. Exactly.
How was it?
It was nice. I really enjoyed it.
Good.
Really enjoyed it.
We're learning so much, aren't we? This is fabulous. Fabulous. Go ahead.
I had a question about, so I know you're familiar with the essays for the application for winter. So I had a question about the last part of the essay.
Sure, absolutely, yep.
Where it said, if applicable. So I don't know if that was sure, if that question still needed to be asked or not.
Yeah, okay. So I'm going to pull up, I'm on the Accelerated Second Degree Nursing Program webpage, and at the bottom is the nursing application. I'm just going to pull it up right now, okay? So we have a new essay. We actually have 2 questions that you have to answer. Did I pass it already? Go pass it.
No, it's like one of the last.
Yeah,
One of the last
because
things?
at the end.
Nope. Goodness gracious, seriously. I want to.
Do you print it out and handwrite it in, or do you
No,
just
it's type. It's a fillable form.
Okay.
It's a fillable form.
Thank you.
Okay, here we go. So these are the 2 questions that you have to answer. We're not looking for a specific answer. Everybody's going to answer these questions differently. There's no right or wrong answer, okay? What we're looking for is, did you follow directions? What does it say here? 1 page, okay? We're looking for correct punctuation, spelling, grammar, and if you answered the question. Everyone's going to answer that very differently. There's a second part of this, separate page, only if it applies to you. Do you have course failures? Did you drop a whole bunch of courses? Explain that on a separate page. Explain it, okay? That's all. It's that simple. Yeah. So if only applies to you. If you've never repeated a course or don't have a lot of drops, you don't have to do that.
That 200 word limit is a lot less words than you think it is. To be
Sounds
very
like
concise.
so much.
And again, we don't count the 200 words. I don't, not at all. If it's more than 200 words, it's not going to count. But you don't want to write 4 pages by any means, you know what I'm saying, at all. So we want to know what happened. So maybe you were in pathophysiology and you failed the course the first time and then you had to repeat it. Why? What happened? Okay, this is life. Again, life circumstances, things happen, impact our grades, right? Okay. Or it could be, you know, when I started as a freshman, I did very poorly my freshman year and I bombed my first semester. It was the first time I was away from home. I didn't realize the importance of school. I didn't put forth effort. That's being very truthful, isn't it? We understand that. Absolutely. We get that. So that's all you have to do. Simple. Only if it applies to you. Okay? And then your references, guys, in the application. I'm going to just shrink this down. The reference form is on the website 365 days a year, right here, okay? So you don't have to wait till the application comes out to do a reference. You can do that anytime. The reference form does not have to be typed at all, okay? So when you were talking about it's not online, nope, it's not, but it's a fillable form. So if we go down to, let me go to the front page here, right here, you pull it up, you type in it, print it off, okay? And it has to be typed. I'm just amazed at the people who don't follow directions, and that's the thing that we promote. Follow directions, follow directions, follow directions. It's so important. As a nursing student, as a nurse, you have to follow directions. If a doctor tells you to give so much meds, you're not going to give a different med, or you're not going to give a different dosage of a med, correct? You have to pay attention to detail, and that's expected in nursing, okay? So you type your application. Your references are in the nursing application. They can be typed or printed, or typed or hand wrote. Doesn't matter to us at all. Your person writing that reference for you fills this out. They sign it at the bottom. They put it in an envelope. They give it to you, or they mail it to you. And you put everything in one application together. Everything in one envelope. Go ahead.
Couldn't you type up your information on the reference letter, the top, and then give it to them?
Yeah, absolutely. Okay. Yep, absolutely. You can save it to your desktop, email it to them, but they can't email it back to you because, you know, it's got to be an envelope and they have to sign that back of that envelope.
Is there 2 places where people have to sign right below the information that you fill out, your personal information?
They have to sign.
Above.
Yep, their name and their signature.
Above,
yep.
Higher on the form, please.
Up above.
The applicant has to sign.
You
Only
you have to sign. You waive your right or do not waive your right.
That's what it was. Okay, I read it earlier. Okay,
yep.
Gotcha.
So they have to mail it to us? They can't just put it in an envelope and give it to us?
Yeah, they can give it to you. Yeah, absolutely. I'm just saying there's some people that have references that live a distance away. So you could email this to them, and then they would have to put an envelope and mail it to you if they live a distance away. Because they can't email it back to you. It's got to be in a sealed envelope with their signature over the back seal. Because anybody can write a reference. I could write a reference for myself and put it in an envelope, right?
2 reference questions. So you'd actually have to print it out, sign it, then mail it to them if you were to sign.
You can scan it.
Oh, you can scan
your
signature there.
You can scan it.
And then you said 2 references, one of them having to be or preferably be a science professor. What about a nursing professor like Margie, or like a PHS professor like Dr. Solly or something?
Yeah, absolutely, absolutely.
But those aren't science professors, so would you kind of not necessarily be docked points with that?
No, not at all.
Those kind of count
as
their healthcare professions.
But Margie Marie Wright, is that who you're talking about?
Yeah.
Who teaches patho? That's a science course.
Okay.
Patho science.
Okay.
That's heavy science. Yeah, absolutely. Yes. And typically if you have Margie write you a reference, she gives them directly to me. She doesn't give them to you, and that's absolutely fine.
Okay.
Yeah, that's what she does. Because she gets a lot of requests for those.
During the 3-week window, you can turn in your application. Is there preference given to who turns it in first versus any time as long as it meets that deadline?
Absolutely. 5 o'clock by September 4th. Doesn't matter when you turn it in. So your references, you need 2, 1 academic, 1 professional. Professional means if your supervisor, okay? You don't have to work at a high-end job to get a reference. If you're a student and you work at McDonald's and that supervisor knows who you are, knows your work ethic, and you have a strong work ethic, you are great with customers, you're on time all the time, you take extra shifts, you're great with customers, that's an excellent reference. Doesn't have to be from some high-end place, okay? Go ahead.
It's the 4th, I just want to double check, it's not the 4th, right?
It's the 14th.
14th, September 14th. I'm sorry, 14th.
You said the 4th.
Did I?
The 4th.
Oh, 14th. Friday, September 14th.
It's the second Friday.
Second Friday. It's always the second Friday of September, always the second Friday of January.
And so where
Always.
do you hand it in, east or west?
That's a good question. Right now, it's in East. But we are in transition right now. I was on East. I moved to West. I'm going to be moving offices again. We're all in transition. There's things all in the hall. It's looking, so there'll be a sign on the door. Right now it says East. That's where you're going to turn it in right now.
We just bring it in and drop it off.
Or mail it in. Mm-hmm.
Oh, is there a mail in?
Yep, you can mail it in. Yep, on the application it does tell you that.
Oh, okay.
Yep.
There's an
Yep, there's an address. Everything you can mail it in. Yep, it's just got to be postmarked by that day.
Thank you.
Yep.
And the only thing you're physically signing is your signature. That's the only thing, obviously, that you can't type up.
Correct.
Okay.
Correct. Exactly.
So you can send everything in one envelope to you guys.
That's what we tell you. At the bottom of the application, it tells you. Print your application, turn in these pages, tells you the page numbers, tells you transcripts, essay, references, put in an envelope, put your name on the envelope, your UMID ID on that. Tells you everything you need to know. We see how many people follow directions, right? It is a big deal. Absolutely. Mm-hmm.
It tells you where to, exactly who to send it to. Like,
Yep, it tells you. Yep, exactly. It doesn't tell you specifically. It says school of nursing. Yeah, school of nursing. Go ahead.
So back to the references, so I could use like my
Mm-hmm.
manager for mental health.
Mm-hmm. Yep, absolutely you can. And it doesn't have to be a current. If you worked for somebody 2 years ago and they're a great reference, you can have that person. Mm-hmm. So you can have up to 3 references, up to no more than 3, 1 academic, 1 professional. Academic means somebody, doesn't have to be PhD prepared, but somebody that you've had as an instructor, okay? So we've talked about references, we've talked about essay, we've talked about prereq GPA and less 30 credit GPA, right? Did we talk about less? We've been all over, but that's great. You guys have great questions. Did we talk about less 30 credit GPA? We didn't? Okay. So yes, we see your cumulative GPA from every school that you've attended, but what we count from the nursing application is your last 30 credits. So we go back from the latest completed semester when you apply to this program backwards, okay? Doesn't matter where you took these courses. It could be at 5 different schools, but we just go back in chronological order. So this is the example I gave earlier. So if somebody's applying in the fall, if they took 5 credits in summer 18 and they took it at OCC, then they took 5 credits in spring at Mott, then they took 10 credits in winter at UM-Flint, and then 15. This student would be 35 credits. It's a minimum of 30. We are counting all 35 credits because this is 10, 15, this is 20. I can't just pick out 10 credits here because what if half were A's and half were E's? Okay, we got to be fair to everybody. So this student, it would be 35 credits. It could be 30, it could be 32, 33, it could be 40, it could be 45, depending on how many credits you've taken each semester. So if a student took 15 and 15, that's all we would be doing is those 30 credits, okay? So that's how that works. You go back from the latest completed semester backwards, okay? So if you have a semester in there where you didn't do so hot, that could impact your last 30 credits, and that has happened to a few students. They haven't been able to apply because they haven't met that 2.75 because of that one semester they bombed. So be careful of that. You got to figure that in. Okay? What else?
What is the actual average GPA of accepted?
So what we tell people, we don't necessarily give that out because again, we're looking for good nurses. Just because you're a 4.0 student doesn't mean that you're going to be a good nurse. And so it's high, but I'm not going to tell you that because I don't want people to get discouraged saying, I don't have anywhere near that. Doesn't mean it. Doesn't matter. If you don't have anywhere near that, that doesn't mean that you're not getting in. You could have a fabulous essay, excellent references, and you might be a lower GPA student, but we feel in all of your application that you'd be a really good candidate for our program. But good question.
With the accelerated second degree, it is much more selective.
Much more.
Just know that.
Yeah, just know that. Mm-hmm. Mm-hmm.
Much more selective, is that what you said?
Yeah, because we have a lot more people apply to that, and the students who do apply, They have very few repeats. They've done very well in their science courses. They're getting A's and B's. They've done very well in patho. Those are the types of students that apply to this accelerated program. Go ahead.
Do you take into account that between the difference of like repeating something in your undergrad compared to one of the prereqs?
Correct. And when we're looking at repeats, we're only looking at prereqs. That's all we're looking at. Yeah, we see those other repeats, but they're not counting for nursing.
So if you got a B or let's say a B minus in a prereq, a science prereq, would it be favorable to retake that for a higher grade?
It just depends on what your other science grades were. If they were all A's, no.
Okay.
If they were all B minuses, maybe.
But if they're, let's say they were all A's and then you had one B.
It's not going to kill you.
Okay. But it wouldn't be looked at badly if you retook it and got an A
No,
in it then?
no, not at all. Not at all.
What I would, as your advisor, what I would encourage you to do is apply anyway, and if you're really that concerned, sign up for the class during that semester while you're waiting for your admission decision. Worst case scenario, you do get denied, and now you have already repeated it, and you've got it ready to go for next.
Yeah, absolutely. Yep, great advice. Great advice. Yeah.
Question. I'm gonna have to take all the prereqs, I already know that. But this part right here where you have to have like background check and all of that.
Yeah, that's something that when we have orientation, if you're admitted to the program, we have an all-day orientation. We talk about all of that for you, where you have to do it, how much it costs, all of that. So you don't have to worry about that now. It's only if you're admitted to this program. So some schools make you do a background check to apply. I don't think that's fair because what if you don't get in? You just spent all that money, you know what I'm saying? So we only make you do it if you're admitted to the program.
A couple questions. How does this program, the traditional as well as the accelerated, mirror the nursing program on the U of M campus, on the Ann Arbor campus, their program, or not at all, totally separate? And then secondly, what is the diversity of your instructors throughout the program in terms of those who are either actively, active nurses or nurses who work on the floor, their background in terms of the populations that you'll be around, the clinicals?
Okay, so the first question was, I already forgot it, sorry, terrible.
How closely does the program mirror?
It doesn't. We are all the University of Michigan, but we are 3 separate campuses. 3. And in Ann Arbor, they did have an accelerated second degree, but they sunsetted it a while ago. So we only have it in all the 3 campuses. We're the only ones that have it, okay? So very different. And their program, their traditional program is students are getting in right from high school to that. You can transfer in, but most of the students are getting in right from high school. So very different. And then you talk about diversity, correct?
Diversity with the instructors throughout the program in terms of their background. And their experience level?
Yeah.
Are they all nurses?
Yeah, everyone who teaches in our nursing program is a licensed nurse. They have a minimum of a master's degree. Majority of them have a terminal degree, either the DNP or a Doctor of Nursing Practice, or they have their PhD. They all teach in their specialty. So when you have OB, we have a nurse practitioner who has her Doctor of Nursing Practice, and she is a nurse midwife, okay? Margie, her specialty is med-surg. She teaches med-surg, okay? We have a PEDS faculty member. Her specialty is PEDS. She's been teaching PEDS and working in PEDS for years and years. She only teaches PEDS, okay? So you're gonna have all varied experience all the way through the program, from critical care to med-surg to PEDS to OB to community health to mental health. So you get to decide then when you graduate what you like, okay? And that's the nice thing about nursing. But yes, everyone has their specialty that they teach in, yes.
And then at the clinical sites, when you travel out to the clinical sites in the various hospitals and whatnot, the diversity there.
Same thing.
In terms of where you're at, the type of population you'll be dealing with.
Yes, and it's different. Hurley has a very different population than Genesis does, okay? And McLaren has a different population. So you're going to get all those experiences so that you can see what that's like, okay? Hurley's a level 1 trauma center. You have a much different experience than at Genesis. Yes.
I think it's also important to note that all of your instructors are currently teaching,
Yeah.
working too. So it's not that they work now, they've retired to teaching. They have to, accreditation purposes,
Yeah,
have
and
to be.
a lot of nursing programs are not like that. We are one of the few that almost every single one of our faculty who teaches is still practicing. Nursing changes all the time. That's what you want. And so when you're in the clinical setting too, our clinical instructors are working full-time nurses, and they're also then working part-time for us to teach clinical. That's a good thing, a really good thing. Yes. Yes. You guys have seriously been one of my best groups ever. You have asked excellent questions, and I'm willing to stay till 8 o'clock if I need to. I'm here to answer those questions.
You're amazing. That's nice of you. That's
You know,
helpful.
but the thing is, you're here to make that informed decision if this is a good fit for you and if nursing is good for you. So what else can I answer for you? Go ahead.
Say you apply and you don't get in. When do you get to apply again?
The next semester. So if you don't get in, you can meet with me or someone in the School of Nursing. We will go through your application. We'll tell your strengths, weaknesses, what you can do better next time. It could be like you were an excellent applicant, but we only had 40 seats. You know what I'm saying? Could be one of those. I'm very honest. I don't sugarcoat things. If I don't feel that you're a good candidate, I will tell you. That is unethical to me. I'm not going to waste your money or your time to say, oh yeah, keep taking classes, reapply, when I know you don't have a chance. You know what I'm saying? That's unethical. And I have had to tell students that before. It's not a fun conversation, but it's a truthful conversation.
Yeah, I was wondering that because you said you accept twice a year. So I was like, well, man, do I have to wait a whole year?
No, so you would just reapply to the next semester. And sometimes that happens. Sometimes. Go ahead.
I applied, like I said previously, for the undergrad traditional program. Would I be applicable to come in and talk to you about my previous application?
How long ago did you apply?
I think the last time I applied was in 2014 to get into Wichita.
I wouldn't have your application. After a year, they're destroyed.
Okay.
Yeah, so I couldn't give you, without having the application, everything that you put. I couldn't talk to you about that because I can't read your essay. I can't look at your references, all of that. I can't.
Okay, so I'd have to talk to...
Well, you'd meet with Chelsea, you know what I'm saying? Yeah. Again, she's not going to be able to talk about your previous application. I mean, she can look at the courses that you've taken, things like that.
My transcripts and everything else and just be like, don't.
And
Don't.
I've had that difficult conversation with students
Oh, I'm
too.
sure.
Yeah.
Yeah.
But you want us to be honest.
Oh, yeah. Sorry, I don't want to give you guys 10 grand before I find out.
Exactly. College is too much time and too much money, and you as second degree students, you're going into debt, and you only have so much money to spend. Get that? Absolutely.
Where do I go to make an appointment?
Do you want me to show them? Want me to?
Do
Okay.
I go to UM-Flint.edu/student success? It kept asking me for my
Is it student success?
email and like my U of M login.
Does it give
Oh,
me?
you're not an admitted student?
Well, now I am, but I tried to do it a week ago and I got it
So
like
it's just.
a week ago.
Yeah.
So I wasn't at
Now
that
you
point, so I
have,
don't have a
now
login.
you have a login, you can get in.
Yeah.
Because you can't make an appointment with an advisor unless you're an
admitted student.
So now I'm an admitted
Yeah.
student.
So here's the
Now
Student
I-
Success
I
Center
didn't
website.
get it.
Again, just umflint.edu/student success, and then you do academic advising. Is it Find My Advisor, or is it advising? I always get confused on your website.
You can go to...
Which one is that?
Click on the SSC advising.
Okay.
And it should be able, same thing. Go, slide down, keep going. There's a, how to graduate.
That's what I'm saying. I tried finding it the other day, and I'm like, what?
Mike just recently changed the website for us. And I'm
But there was something I thought up here. Nope. Oh my gosh, this is kind of crazy here. And maybe it's under. No.
Log into the student system right there.
Where are you? Where are you looking?
Find My Advisor. Oh, but that's for SIS.
I went to make an appointment. Contact your advisor, make an appointment.
Right there it is. Make an appointment.
Oh, right here. There we go. Wow, that needs to be big bolded. Yes, make an appointment, and then it comes up, and then right here. Are you currently enrolled? Yep, there you go.
Yeah, so you have to click yes. If you click no, they're going to direct you to call the
Admissions.
office or
Yeah,
admissions.
and that's what I did.
Yeah, so if you click yes now, you can log in and the login will automatically allow you to request an appointment. You have to check your email, your UM-Flint email after you do that, because you're just making a request for an appointment. They will email you back to tell you that your appointment's been made.
Okay. And will it automatically make it with you, or do I need to put in?
You're going to tell them that you're a pre-nursing, and they will automatically make it with you.
Okay, awesome, thank you.
Do you get automatically assigned an email address when you become a student?
Your unique name at umflint.edu. So you were assigned.
That's what they kept asking when I was trying to make an appointment. What's your unique name?
You are the one that established that.
Yep.
I haven't yet.
Oh.
I just got my acceptance.
Oh, got it. Okay, got it.
And it takes about 48 hours for them to get all that info shuffled to you.
Yeah, that's what that email said also, that it'll take a minute for you to be able to.
They're pretty quick
register.
with it, but it's like one email a day you'll get with all that info.
Okay.
So we have to be admitted before we can see you?
You can contact admissions and have an unofficial transcript evaluation done, and then email me, and we can set up an
Yeah.
appointment. But
So-
you have to have that unofficial transcript evaluation done before we can meet.
They have to, Chelsea has to see what's transferring over. She can't help you unless she knows what's transferring over.
Well, mine have
So-
done that already.
Yes, that's
Yes.
automatic once you're admitted.
Once you're admitted. If you're admitted, it's been already done.
Already.
And then if you need to send admissions, they'll do an unofficial, okay? And it's just admissions at, I can't write, at UM-Flint.edu. And you just send your unofficial to that, request an unofficial transcript. I tell students, apply to the university. There's no fee to apply to this university. Send official transcripts, have an official done for you, okay? That's the best way to do it. It doesn't take long. It only takes a couple weeks for that. But they might take a little bit longer with the unofficial, okay? But unofficial you can request an unofficial.
Are the majority of the classes for the program located here in this building? Or will we be all over the campus?
All your nursing courses are in this building, majority of them, okay?
Prerequisites are going to be mostly
Different.
in the science building.
Right, correct.
I have to get, well, I have transcripts from I can get over here quicker, but my design school, I have to send to Chicago.
You will for your application, but for the unofficial evaluation, I doubt any of your design school classes.
They're not going to transfer.
Yeah.
So do I have to, I mean,
You will have to.
I still have to
They
bring
will
it?
not admit you without you sending that over there.
Right,
so for the unofficial, do I need it?
No.
no.
I can just get the ones from mine.
Correct. Yeah, because they're not going to, it's a technical school. They're not going to transfer. You're not going to have any prereqs from that technical school.
Right.
None.
Yeah, that's why I
Right.
said I'm gonna have to take all the prereqs.
Right.
I need it 3.82.
Good for you. Yeah, go ahead.
Okay, LBN with their transcripts, they only send via mail, via them straight to location.
Yep.
They won't send them to you.
Not at all.
Okay. Okay.
They won't fax, they won't do anything but via mail from them to school.
Then have them sent directly to school nursing.
Yep.
But in your nursing application though, not on a little sticky piece of paper, not on a half sheet of paper, on a big 8.5 by 11, write me a note. Vicki, my transcripts were sent directly to you. This is the only way they'll be sent to you, okay? So that I'm looking for them. If you don't put that note in there, I have no clue. We want everything to be together in your nursing application, but if Albion only does that, then I'll work with you on that.
I'll get the unofficial.
Because of how Detroit Mercy, because I'm also applying to the Detroit Mercy program, they like it as soon as you can send them, even if you don't have your application in.
No.
Sending. So I did do that to you guys, so you guys probably just got rid of them, I'm guessing.
How long ago?
This summer. So
Oh,
You
probably.
send it directly to the school.
School nursing?
Yes.
Huh. We're crazy busy all the time. And if we just got transcripts, we're like, what are these for? You know what I'm saying?
Yep.
And if you didn't send it,
Mercy likes it, and they have folders on everyone.
oh gosh, no.
Chances are they may have sent it to admissions though.
I sent it to both. I did go to the-
Oh, you did? Admissions and school and nursing? But if I get a transcript and, you know what I'm saying, if we're not in the application period, I then say, I've opened these and I send them right to admissions because there would be no need for me to have them.
Okay.
Yeah.
So I'll have them apply it, send it again.
Yeah, right.
Maybe shoot Vicki an email, let her know it's coming, we can request it.
Yes, I will do that.
Yeah.
So then I have to go to admissions
At my,
first.
Is your email
and
anywhere
request
in the-
an unofficial. but then
If you go on the school nursing website,
they'll make-
Yeah, I was gonna say.
No.
yeah, it's on there.
email needs to request an
Yeah.
appointment because you don't have. the-
And you can also just email nursing email It's a nursing email. It's called nursing email, all one word. You can email nursing email.
Okay.
Just show them. They're the ones who are going to do the unofficial evaluation for you.
Go ahead.
If I'm a UM-Flint grad, do I have to like send in my transcripts
Nope.
and everything else to even set up an appointment?
Nope.
Or I can just set up
Nope.
an appointment?
Mm-hmm.
Okay.
Now that I'm like a U of M-Flint student, do I have to send in my Michigan State like in a sealed envelope with my transcript when I apply? But my U of M classes, I don't need to.
Correct. Correct.
So you're just like on the computer and with these folders all at the same time? Like looking at all the things when you're going through?
Oh yes, it's a huge endeavor. Huge. Huge.
Roughly when will we know if we've been accepted or not?
It's a long process. I'm one girl, so, and with everything else that I have to do. So if you apply in now, you won't know till end of October, beginning of November.
Okay.
And if you apply in January, you won't know till April. One man show, me.
What type of support is offered to students throughout the program?
Lots of
Is there
support,
mentorship?
really,
Is there,
yeah.
You know, one-on-ones if you seem to, if you're having issues with certain classes or support groups.
Good question. There's no reason that a student should not be successful in our program, point blank. Our faculty go the mile for our students. If a student is struggling, they will reach out. You also need to reach out. The faculty are always there to help students. They love students who are like, you know, can I meet with you at office hours? I need to discuss a couple things with you. They understand. We have a different student population here. We have students 18, 19, all the way to people in their 50s in our nursing program, okay? So we also have tutors for almost every single nursing course that students, when they go through. We have a writing center that students can go to. You are not a number at U of M-Flint. You definitely are a person. We know who you are. We know your circumstances. When we see you in the hall, we will say your name. That's how it is here. If that's what you're looking for, then that's what we would have to offer you. We are not the University of Michigan, Ann Arbor, where there's 45,000 students. Not that way at all.
I'm a U of M-Flint grad, and I just came back here after 10 years away, and people still know my names and still ask me questions and stop me in the hall. And I'm still running into people that I didn't know were still here. You're known here.
I go to the rec center at night after work to work out, and I'll see my students all the time. They're like, "Hey, Vicki," I'm like, "Hey, how you doing?" And that's just how it is. Yeah, we truly are a family here.
What is the maintenance GPA throughout the program?
You have to have C+, so 2.3.
2.3?
Rarely, ever. Once your students get in the nursing program, they excel, because that's what they want to do. Rarely do I ever have a student even close to that. Rarely. Rarely, yeah.
But on top of that, there's all sorts of resources here, so there's no reason you should add 2.3.
Right. We just had this conversation with a admissions gig, and we had a whole bunch of transfer students and high school students, and my director said the same thing. There's no reason a student should not be successful in our program. If you are doing the work and what you're supposed to be doing, there's no reason that you should not be successful. No reason. Especially with all the resources that you have and how faculty are very much willing to help students. Yeah. What else, guys? Go ahead.
When you, for the essay, are we mentioning our ID in the actual essay, or just on a separate section, like at the top, bottom?
Your UMID?
Yeah.
Just put it anywhere.
Okay.
Doesn't matter.
It
doesn't. It's not APA format. It's not MLA format. Just put it somewhere. Top right.
We can't have our name in that.
Correct.
Correct. Okay. So it's got to be like a.
Our name isn't on it.
Your name is not on your essay. It's your University of Michigan ID number.
And 2 questions on 1 page.
Okay. Gotta be very concise, don't you?
Very concise.
If you do a good job, both questions can be answered with the same story. Or you can go separate.
If you have no more questions, but again, I'm willing to stay, feel free to stay. But I thank you guys for coming. Did you find it helpful? You guys were seriously one of the best groups I've ever had. Tons and tons of questions, tons of questions. So I look forward to your nursing application. You know, utilize the resources, use Chelsea. We're all here to help you in this process. Okay? Not hard. The easiest part of getting in is the application. The easiest part is filling that out. Do not sweat that part.
So we can't get our transcripts that we sent here from other universities from addition.
No, they will not do that. Do you know how many people would request that?
Yes.
They would be, they would constantly having people in there.
On
No.
top of that, they have to keep it for accreditation anyway.
So as long as I transferred the transcript to admissions, and then does that count as it's already transferred, so I have the transfer credits?
You have the credits, but you still have to have the transcript for the application.
Right. Okay.
Right. Right.
And just to clarify one more time, I took Bio 168 in fall of 2012, so I have fall of 2019 to apply, correct? So
It expires December, the end of December 2019.
It starts January 2020 in the program.
I could start in January 2020. Okay.
But the application has to be in
Yeah.
August 2019.
Okay.
Thank you so much.
You're
for
very
all
welcome.
you do.
Thanks, you guys were really
Yeah,
helpful.
there's more of my business cards here.
Oh,
if I
let
have
me move
that
this.
with you.
Yes.
Is it possible to meet before we start semester?
It will be. Yeah. For you, I'll need a half-hour appointment. I've got a few next Friday. So contact them. If you're not available Friday, I have.
I'll make it work.
Yep. I have
I'll
a
make
few
it
next
work.
Friday, so contact them and get in on my calendar.
Okay, thank you so much for your help. Hopefully I can.
No problem.
You guys were really helpful.
Thank you.
It takes so long.
Take care.
Tell me your name again.
Vicky.
Vicky.
I have a long Polish name, Jaskowitz. You're very welcome.
Do you mind if I ask you a specific transfer
Sure,
credit?
absolutely.
I've already talked to Chelsea about it on the phone, but I'm retaking 167 by 167 at OU this fall, and it transfers over because I took it at Grand Valley and I get a B minus in it, so I wanted to retake that. So I had a B and then a B minus in 167 and 168. So
Okay.
I wanted to retake the B minus.
Okay.
So it transfers over. I believe it's their Bio 2100. It comes across, and when we spoke, it came across. But I called them, their biology department. It doesn't have a lab attached to it. Lab's separate, but it's still coming across as.
Then we have to honor that.
Yeah.
We have to honor that.
I'm starting the first week of September,
What's-
and I have anxiety.
What is what's the course?
I believe it's Bio.
Where at?
Oakland.
Oh, okay.
University.
We have to, if it's in the database, we have to honor that.
I'm coming across a couple of them.
What is it? Oakland University, what's the course?
I believe it's Bio 2100.
Yep.
Human anatomy. That's
And it does not have a lab.
And it doesn't have
Are
a
you
lab.
serious?
So their
Wow.
lab, and that's when we emailed, you said, oh, maybe the lab is part of it because it is.
Well, that's
two-
weird. But if it's coming over as this, that means somebody in
So it's
biology
fine.
reviewed it at some time. We
Okay.
have to.
Okay.
If I were you, I would print this, I would print screen
Right
this
now.
right here.
Yeah.
And keep that and
Okay.
keep that, because if I come back and I score it and when I look at it, if it's not, you can say,
Was that
I
was
did
yeah.
that for another student
Yep.
recently and put it
Okay.
in our notes.
Yep.
So that
Okay.
you had that.
perfect? Yeah, because it doesn't come across when I called. She goes, no, the labs are completely separate, which is really interesting.
well, and
because
again,
you-
why is it transferring over? It doesn't have a lab. I find that very odd.
Well, the same thing with the mod. She's right. It needs to have the L there.
Yeah,
and
it does.
Don't have the L on there.
Mm-hmm.
And most times they don't let you take that course unless you have a lab at the same time.
Right.
Yeah.
Correct.
Or if it's included, like the course here. So,
Mm-hmm.
so that would be that.
It's going to meet the requirement we need to honor.
Okay,
Mhm,
and that
yeah.
wouldn't be a negative if I retake that to get a
Nope.
higher
Well,
grade.
the other people on the committee aren't going to have any idea it didn't have a lab, first of all.
Okay, and that since I took anatomy, that was I believe my sophomore year. So since it's in the later half of my education, that the grade will be replaced.
Correct. Your new grade replaces the old grade, always. Mm-hmm. Yes.
Thank you so much. I
You're
just wanted to
welcome.
confirm that
Yes.
because class starts in 2 weeks.
Oh, I know, and you want to make sure you not spend all that money.
Tuition, yeah.
Exactly.
So thank you so much. It was a pleasure to meet both of you. I
Yeah.
appreciate
Aha.
your time. Thank you.
Have a good night.
You too.